Hey guys, Doc Heps here. So your doc told you that there are many layers to the bladder, like a cake or like an onion, and you're wondering what's up with all these food analogies. Well, I'll give you the scoop on what this means and what your doc's talking about. So appreciate your time. Guys, Doc Heps here. So the question we're going to talk about is what's the deal with all these layers of the bladder your doctor may have mentioned? It's especially important in folks who have bladder cancer, and we're going to go over these layers. We're going to talk a little bit about bladder cancer and what two components that I believe are essential for every bladder cancer patient or family member to know. The bladder is kind of like a cake or an onion in the sense that there are a few different layers. So the layer on the surface that touches the urine is called the urothelium. And we call that stage A in folks who have a bladder tumor that's just on the surface of the bladder. Behind that is an area called the lamina propria. And if you have a bladder cancer that invades into that second layer, that's called stage 1, tumor stage 1. And that tells us that the roots have grown through that initial lining, the urothelium, and grown into that lamina propria or the scaffolding layer. We call that stage 1. Behind that lamina propria is a muscular layer. So if you have a bladder cancer that has grown roots and has gone through the initial lining, that would be stage A, through the lamina propria, stage 1, and then into the muscle, we call that stage 2. And that is a tumor that is potentially a pretty aggressive or very aggressive tumor that may need some more aggressive treatment. Beyond the muscle, there's a fat layer, and beyond that, there's the adjacent tissues and organs that surround the bladder. So what happens is maybe you had an episode of blood in the urine. You went to your urologist or referred to your urologist did a scan and a scope, and they saw a polyp in the bladder. What that urologist would do is likely set you up to undergo a resection of that bladder tumor or bladder mass under anesthesia. We use a special scope that's placed into the urethra, and that scrapes that bladder tumor out. And now we scrape that bladder tumor ideally deep enough to ensure that we sampled those layers that I had just talked about, and those specimen, that tissue gets flushed out of the bladder and sent off to the pathologist. So 3 things that the pathologist will really tell us. They'll tell us, number 1, is this a cancer? We call bladder cancer. It's also called urothelial cancer, but they'll help decipher out using their special techniques, is this truly a cancer or not? And then beyond that, they'll tell us, number 2, is this a high-grade cancer or a low-grade cancer? The urothelial or bladder cancers come in mainly 2 different varieties, and genetically they're very different animals and they behave differently. High grade is obviously more aggressive. The cells look different, angrier. Potentially they have more risk of invading deeply into the bladder, whereas low grade is less likely to invade or grow roots, but both can tend to recur and we have to monitor it for them. But high grade is treated differently than low grade. So the third thing, beyond telling us whether this polyp was a cancer, is it high grade or low grade cancer? If it is a cancer, is a pathologist will tell us what stage it is. How deeply does that tumor grow into those layers of the bladder? And again, if it's just on the superficial lining in the urothelium, it's called stage A. If it grows into that scaffolding layer called the lamina propria, it's called stage 1. If it grows deeper into the muscle layer or beyond, it's stage 2 or tumor stage 2. And again, it's important to know this because these are treated differently. For example, if you have a high-grade tumor and maybe it's stage A or 1, your urologist may recommend treatment like putting a medicine in the bladder. to help prevent the tumor from recurring and progressing. Whereas if it's a low-grade tumor and just on the surface, he may recommend doing nothing except for coming back every few months to look in the bladder and make sure it hasn't recurred. Now, if it goes deeply into the muscle layer or keeps coming back, your urologist may recommend, especially for high-grade tumors, that you have to either remove the bladder or consider chemo, radiation, different treatment options that are beyond the scope of this video. But essentially, my goal is to let you know that it's very important to know if you have bladder cancer, number one. If you do have it, then you should know whether this tumor is a high-grade or low-grade tumor. And you should know the stage of your tumor, how deeply that tumor grows into the bladder. These three things are essential components for every patient with bladder cancer, every family member who helps to take care of a bladder cancer patient. Obviously, your urologist will have that easily available to you, and it will help guide you and guide him so that he can provide the best care. So I appreciate your time. Thanks for watching. Hopefully this video helped you out, and check out our other videos. Again, thanks.